Dear friends and colleagues. Sensodyne welcomes you to this exclusive webinar which has been organized in association with IDA Ludhiana branch. Before we begin, I would like Dr. Atamjit to say a few words.
Thank you, Dr. Anil. Thank you for inviting me on this platform. और सबसे पहले नमस्ते, सत श्री अकाल, good evening and hello everyone. Myself, Dr. Atamjit Singh, and I am Honorary Secretary for IDA Ludhiana branch. And today I feel privileged to part of this event. We thank you, Sensodyne, for coming up with this so much, you can say, in-demand topic. And I am glad that we are all the part of this event. And Dr. Akash, you can say it was our dream, it was IDA Ludhiana dream that we will do a seminar, a live seminar. Yeah, but due to COVID, we are doing this on a virtual platform, though we are doing on a virtual platform. But still, I guess a lot of people are joining it, and you can say a blessing in disguise it is. And IDA Ludhiana has, you can say, done all the things after pre-COVID, COVID time, after COVID, and the activities which has been done by IDA Ludhiana. I will just show a small video, and you can see that what the activities has IDA Ludhiana has done. So I will be sharing a small video for that. So you just saw that what are the activities we did. You can say pre-COVID, we were the live sessions, house full session. And then after when COVID times comes, we had numerous Zoom meetings to discuss all the guidelines and everything with Dr. Anil Arora sir is here. We had the Zoom meetings with him also. And all the senior guided us very well. We came to the conclusion, we made a uniformity of charges for IDA Ludhiana branch. That was the historical thing which we can say that was a blessing in disguise as a COVID part, you can say. And after that, we had all this virtual digital, this you can say event CD programs. We are holding it and we will hold till this 2020. So not taking much of time, now I can say I invite our President, Dr. P.S. Grover, for the welcome address, please.
Yeah, thank you so much, Dr. Atamjit. It was a beautiful video that we have made, and we've done a lot of activities this year regarding that it was a COVID year. And it wouldn't have been possible without our blessings of the seniors, mentors, and your support and our respected ECT. So I formally welcome, I welcome all the seniors and mentors and colleagues. The students are also joined in, my respected EC team who's supporting me unconditionally, and my extended IDA family. I especially welcome and thank Dr. Anil Arora sir from Famed and Fame. We have invited him earlier also, and he's been so kind to be here and always supporting us. And our star speaker for tonight, Dr. Akash, we wanted you to be here one-on-one in Ludhiana, but still you are there, so it's a blessing in disguise. And the topic is like the hot topic, and everyone wants to do photography. So I'll also welcome and thank Mr. Devrat Desai, the brand manager from Sensodyne, for coordinating with us and associating with us and making this event a possibility. In the current scenario, the photography is very helpful, not only in documentation of the cases, but in educating the patients also, by showing them before and after pictures, and also saving ourselves from medical legal cases there, which have become so common nowadays. So not wasting much time, I'll again hand it over to Dr. Anil Ora sir for the speaker's introduction and further proceedings. Thank you so much. Over to you, sir.
Thank you so much, Dr. Grover, and thank you so much, Dr. Atamji. That was a really wonderful video that you showed, and a lot of activities that you've been doing. I have been following the IDA Ludhiana branch pretty closely, and I have a lot of friends in the branch also. And it was my privilege to have joined your Zoom meeting some time back. Thank you very much for the honor. And as Dr. Grover has already put it across, the importance of photography, the documentation, not only for marketing purposes, but also from the medical legal point of view, I don't think we need to emphasize more about the topic. But yes, I would like to say something about the faculty. I have personally known Dr. Akash Akinwar since many years now, and he has been a faculty in FAMDENT shows also earlier. He has penned some very nice articles for FAMDENT publication. His passion for wildlife photography is quite known in the dentistry circles. And now with this mobile dental photography that he's brought up, it's something really amazing and something which anyone can do. If for those who don't know much about Dr. Akash, he is a practicing implantologist and periodontologist in Mumbai, actually practicing quite close to me. I'm in Andheri, he is in Vileparle. He's also from GDC Mumbai, like me, and a prolific practitioner and a passionate, of course, photographer, which you will slowly, surely, and very shortly witness. Over to you, Akash, now, without much ado.
I will share my screen first. Yeah. Is it visible to you, my first slide?
Yes, it is.
Okay, perfect. So, hello everyone. Good evening, Sat Sri Akal to each and every member, core committee members, and all office bearers of Ludhiana IDA branch. Thank you very much for having me here today. Believe me, I am a great fan of Punjab region overall. I have been to Chandigarh and other parts repeatedly since last 3-4 years for conducting various lectures. I'm a hybrid actually. I'm a hybrid of South Indian and Maharashtrian, but I'm very much fond of Punjab. You won't believe I have Khanda tattoo on my arm. So I have special liking and feelings for Punjab. So thank you very much once again, and let's begin with this unique session. At the onset, let me tell you, if you are a practitioner, this one session can change your way of looking towards your practice, your way of looking towards dentistry, and your way of looking towards your patients and whatever work you are doing on daily basis. So I will urge you to pay attention. Each and every slide is important. I am going to share plenty of tips and tricks which will be useful to you. So let's begin. Okay, so our today's agenda is introduction to mobile dental photography, scope and benefit of mobile dental photography, and most important part which I will focus will be tips, tricks, and techniques of MDP. And yes, we don't have demonstration right now, but maybe some other time we'll have that. So today we all are here to bring a big change in practice. And as we all know that change is the only constant thing in this life. We all must have witnessed this kind of changes, from that tring phone to Nokia 3310. That was first law of almost everyone in college days, school days. And now we have all these smartphones. So dentistry also has seen plenty of changes in last few decades. Maybe digital x-rays, Then we have microscopes and CBCT, implant and CAD/CAM. So many things are still coming in, and the future is really great. Future is going to be magnificent in dentistry. Be ready for that. And when I talk about future, believe me, documentation is going to be an integral part of dentistry. You have to be ready with all your documentation gears. And I believe PFM to metal free is a big game changer in dentistry. It has changed everything in restorative dentistry. So, as a rule, I believe better materials will always give you better results. So we accepted everything, but still no to documentation. Why? What is the problem? I see a lot of practitioners, they have excellent skills, but still they are not documenting their cases. So I believe the biggest problem is, if it's important to you, you will find a way. If not, you will find an excuse. So maybe I believe a lot of practitioners have not realized the importance of documentation. A lot of people think that ये लोग मेंटर है इसलिए ये लोग डॉक्यूमेंट करते हैं. That's not the truth. Lot of people think that अरे इन लोगों को फेसबुक पे केसेस दिखाना होता है to show their work. That's why they are documenting. But even if you ignore these facts, apart from being a mentor or you want to show your work on Facebook, documentation can change your entire way of practicing dentistry. It can take your practice from here to here. This is what I have observed, and we all have been observing in the practice of all our friends who are documenting cases on day-to-day basis. So take out this notion from your mind that documentation is for specific people. It's for everyone, and I will prove that today. I think all the magic happens out of your comfort zone. And the problem is we always prefer to stay in our comfort zone. This small circle is a comfort zone. And we need to jump from this small circle to this big circle where all the magic happens. So be ready to change your comfort zone, because many a times whenever someone comes to your clinic with a new thing, our first reaction is, no, I'm happy with my existing setup. Okay. So never say that. Always try to see what person is coming to your clinic with, what they want to show you. Always try to use new materials, new techniques. You never know how it will change your practice. So at the onset, let me tell you the benefits of photography. As I am into photography since last 8 to 10 years, in DSLR photography, in mobile photography. So let me share some benefits of photography. The biggest advantage of photography is you can freeze the moments. You can capture time. That's the only way to capture time. Otherwise, we cannot catch hold of time. So when it comes to dentistry, you can capture that moment. And when you finish your patient, you can go back to that case. You can go through photographs and you will come to know what mistakes you have done or where you need to improvise for the next case. Second point is, travel, walk, and visit nature. Yes, because of photography, I do travel a lot. I travel all across Asia for photography, whether it's a DSLR or some other way of photography. So that's another advantage. It's the biggest stress buster. And even in practice, when I am documenting cases, it makes my work quite easy. That you will experience when you start documenting your cases. Yes, because of photography, it gives me opportunity to meet different people, to check different culture and places. And believe me, most of my friends as well as patients were actually unknown to me, but I met them in various tours and now they are my friends and ultimately patients. So that's another advantage of photography. It gives positive thinking and positive energy. When your cases are appreciated, when your photographs are appreciated, it gives you boost. And yes, it boosts your self-esteem. And photography is a very creative field. It stimulates your creativity and imagination. So it is definitely going to help you in your practice if you document your cases regularly. And yes, photography helps to see things that you may never notice otherwise. And this rule is applicable not only in wildlife or bird photography, but also in your practice. It has happened with me many a times. I have called my patients after going through their cases or their photographs that something is wrong. I need to correct that. I called my patients. So this is the way of working in your practice if you are documenting cases. And yes, photography is absolutely healthy hobby. Nobody will ever object that don't do photography or don't travel for photography. That's another advantage. After these basic benefits, now let's move on to important part, why people say no to documentation. So I have done a small survey. I asked almost 50 to 60 practitioners why you are not documenting. So let's go through the common reasons. First reason was I don't have time, it's time consuming. Believe me, photography is not at all time consuming. I will prove it and I will explain you properly. If I am doing a third molar surgery, if it takes 30 minutes, maybe with photography, you can add 5 minutes extra, not more than that. To take 8 to 10 images of a specific step, you don't need more than 8 to 10 minutes or maximum 5 minutes, max to max 10 minutes. So it's not at all time consuming. And whenever I don't have patient, I am free, I am sitting idle, I will go through those photographs, I will edit them, and I will try to compile a good case which I can show to my professional colleagues as well as my patients, which will help me motivate them or to convince them for the treatment. Second answer was I don't know how to document my work. So I will talk about this protocol, what are ways to document your work. Don't worry, I'm going to cover it. A lot of people say I don't have DSLR and lens. People have notion that you need to have DSLR and lens. See, DSLR is altogether different equipment. Mobile is different. There cannot be a comparison. It will be comparison amongst unequals. So let's keep DSLR aside. Let's focus on only mobile. How mobile can change your photography. So a lot of people say, I don't know anything about photography. So today I will share some really important points about photography, maybe which will help you improve your photography skills. And tomorrow onwards, you will able to document your cases. A lot of people said, I am not a mentor or speaker. So a lot of practitioners think that if I am not a mentor, I am not a speaker, I don't need to teach anyone. It means I don't need to document my cases. That's not the fact. That's a wrong notion. We all need to document our cases. As Dr. Anil Arora ji said, for legal purpose also, your photographs can be really helpful. In my practice, at least I take a pre-op photograph so that in future, if there is any issue, I can show that this was the clinical situation. That is why I had to take the decision. What's the benefit of documentation? That was questioned by many practitioners. So the problem is, basic mein rada hai logo ka. They don't know the benefit of documentation. So that is what I am going to cover today. I will try to show you the benefit of documentation, all the tips, tricks, and techniques of documentation. And I will prove that documentation is an integral part of dental practice. And if you are not documenting your cases, at least good cases, not every case, you cannot stay in the practice. You cannot stay in a league. Okay. So how to begin documentation? How to use mobile camera? Maybe your situation is like this, totally confused. After this session, you will able to choose the right option. Okay. So at the onset, let me tell you 3 pillars of documentation. Please remember this forever. Okay. As long as you are going to do documentation or photography. First important pillar is perfect image. I see a lot of blurred images which are not composed properly. People don't even crop their image. They post it as it is. It looks very shabby. Your image has to be clicked properly. So perfect image is the first pillar. If your image is not proper and you know document editing and all, it's not going to make any difference. You have to first focus on capturing good image. I will talk about it, I will tell you how to capture good image. Second important thing that you have to learn is image editing. When I say editing, I am not talking about professional level editing, but as a practitioner, I guess you all are well versed with computers and laptops, at least mobile. So there are a lot of good mobile softwares that will help you edit your images, but I strongly recommend editing on desktop or laptop. We'll see that in the editing part. And do you know what is the third pillar, which is very important? Yes, third pillar is good work, skills. If your work is not good, how will your documentation look good? after, how will your case appear good? So it's not possible. So the best way is, a lot of people ask me, if we are beginners, we can't work like you, your work is different because you are practicing since 5 years, 10 years. So that's very true. I will tell you one simple funda. If you start documenting your cases, believe me, documentation will change the quality of your work. Documentation will take your practice at different level. It has happened with me and so many people. So don't think that I'm a beginner or fresher or my work is not good. Start documenting your bad work. Your documentation will make your work better. I can challenge you on this. Try this in at least 2 to 3 cases. So I will tell you example of perfect image editing and good work. I was doing Avalon 4 mandibular arch, and this is how I captured original image. Now I will never post image as it is. This image needs little bit makeup, and that makeup is editing. So this is how I would like to post this image if I want to show someone. Another image. Here I have given 2 Emax crowns. Try to find out. Maybe as a dentist, it's easy. 2 central incisors are actually Emax crowns. So this is how we document our cases. Now, if I show this image to any other patient, to convince him that you should go for metal free, this is how metal free is at different level. He will not able to find out the crown, and he will say, okay, if you can give me this kind of result, I am ready for Emax. Believe me, on monthly basis, we are doing more than 50 to 70 Emax crowns, more than that. But at the worst condition, 50 to 70 max, because we just show our cases and patients are ready. If patient can spend 7,000, 8,000 or 5,000 rupees for PFM, why can't he spend 8,000, 9,000 or 10,000 on Emax crowns? I'm giving you range because cost may vary from area to area. Another case, this is how I would like to show this photograph. So capturing good image and editing that image is very important. So I strongly urge everyone, especially youngsters, because they have, a lot of energy to learn new things. Please get into editing. It's not difficult. It will take only 1 hour to learn editing. We teach editing in our workshops also. This is another case. This is how I would like to present. That black background and all, I will talk about that in the last session. Some you can say wow images in dentistry, that also can be clicked with mobile. All these images are mobile images. Now DSLR versus mobile. When I say DSLR versus mobile, I am not talking about that old mobile. I am talking about recent mobiles. And believe me, the way we are using new mobiles, the way new mobiles are coming in the market, we are doing a lot of study. We are trying to, do a lot of research in mobile camera, at what level they work. Believe me, I can tell everyone, within 3 to 4 years, mobile cameras will change everything. Maybe you will not need DSLR for many things. DSLR will be there. You will need DSLR for some purpose, but mobile camera is going to capture everything. Be ready. 3 to 4 years, max to max. So SLR is dedicated for photography. We all know that. While our mobile camera is a multi-purpose equipment. We can call, we can check our emails, and we can take photographs. But if you observe in last 1 or 2 years, every company is focusing on mobile camera of mobile. Mobiles are advertised on the basis of their camera features. So camera is taking center stage in mobile industry. Yes, DSLR is for all situation, while mobile camera has limited work when it comes to photography. I will not say that use mobile for bird photography or wildlife, but yes, mobile can be used in many arenas. I will discuss about that. In DSLR, you can attach lens. In mobile also, there are a lot of attachment options or clip-on lenses, but believe me, they are not working up to the mark when it comes to DSLR lenses. They are not true lenses. They don't establish any electrical contact with their mobile or a mobile. They are just superficially attached with the mobile camera. Second, most important factor where we are waiting in mobiles is SLRs have large sensor size. Sensor is the most important part in any camera. So SLR have large sensor while mobiles have small sensor. But I am 100% sure that companies will come out with a miniaturized design where sensor will give excellent result at par with mobile. Even today, there are a lot of mobiles where if I show you cases, you will not able to make out which image is taken with SLR and which image is taken with mobile. So wait for 2-3 years and mobiles will be loaded with a bigger or maybe smaller and advanced and better sensors. So the time is not far. And yes, high optic quality is achieved in SLR, while in mobiles, I will not say bad, but they have good optic quality. I will show you plenty of images. If your purpose is to document your case, to publish them, believe me, mobile can serve the purpose. You don't need to get into SLR and all. But if you have knack of SLR and photography, it will definitely help you to do better photography with mobile. And if you ask me as a photographer, diehard photographer, I would say more than equipment, what matters is person holding it. So please try to improve your own skills, try to improve your techniques. Equipment is always secondary. If you see, DSLR setup is quite big. You need a DSLR, you need dedicated macro lens, you need some external flash, especially ring flash, and you need some other lights for portrait photography. But when it comes to mobile photography, I just need my mobile. And maybe sometimes I use these additional lights. I will talk about these lights in the coming session. Just hold on. You might have seen this kind of images on internet and different social platforms. These are different artistic images clicked with SLR. So I also clicked few images using SLR. These are SLR images. But for that, you need a dedicated SLR, a lens, diffuser, and we do a lot of, you can say, jugaad work to diffuse flash so that we will get a beautiful light. I tried MDP for artistic photography, and these are the images which I clicked using mobile camera. Here I have used light in a different way. We'll discuss about all those factors. So these are different images that I captured using mobile camera. Different mobiles at different times. I was using Asset Plus, then Note 8, then Google Pixel 2 XL. Now I have Note 10. That is also fantastic camera. So this is how I use. You can see those two rings attached over my mobile. So I use this different external light to get a proper detail in my image. These are different images which are clicked with mobile camera. I don't think they are bad. They are as good as SLR images. Maybe optic wise, there is a difference of 19-20. So now we'll move on to next question. Very important question, everyone. Why dental photography? आप सबने documentation क्यों करना है? What is the reason? First reason for learning. Forget about showing your image or photographs anywhere on social media to your friends or to publish them. But first objective or first aim should be to learn from your own work, for work improvement, for work analysis and self-learning. This is what I have done over a period of last 12 years. I have almost 2,000 to 3,000 properly documented cases. Properly means very, very properly documented cases. Second is documentation. I just love to keep the visual record of my treatment or my procedure. It helps me in many ways. Patient education, I feel, is most important for us as a practitioner. What we all want is our patient should refer us many more patients. Believe me, I never advertise anywhere. I have 8,000 patient database. I don't have empty slots. My practice is fully growing. And even today, I am doing a big loss by bunking my clinic in evening time. Saturday evening is supposed to be very heavy. But anything for you guys. Anyways, so education of patient, motivation of patient, and convincing patient becomes cakewalk when you document your cases. Nowadays, I just open my cases and show it to my patient. And the next moment they are ready. Believe me, 99% is the convincing rate. Because when you see the work done by a doctor, you are immediately convinced. You immediately develop a trust in that doctor. That is what happens. Imagine if you visit a doctor who is skin specialist, he opens his 3-4 cases, this is how I treated a patient. You will be like, okay, this is the man who can treat me. That's the impact of documentation. Lab communication. We are communicating with our labs on everyday basis, not only for showing him a stain pattern or shape of adjacent teeth, but we also take patient's photograph on software, we edit them, we show them this is how I want result. And many times we take photographs to show them occlusion, because occlusion is very, very important. Your lab should articulate cast properly. Otherwise, he will send you a prosthesis and you will keep on trimming it in patient's mouth. That usually happens when you don't record bite properly. So along with bite registration, we also take photographs so that patient, lab will come to know how it should be when patient bites. Academic. Now I have left academics in 2010. I was associate professor and PG guide. But that time my publications were 11, and now after 10 years, in 3 months back, I published my 50th case in Dental Tribune Southeast Asia, where Dr. Rajiv Chitgupi is editor, and I have now 50 publications. Being a clinician, never think that publication is not my job. Publishing your cases is altogether different kind of achievement. I want you all to at least document one case and keep target of publishing one case every year, at least one case. Believe me, that will boost your you can say that will boost your overall practice, that will boost your overall way of looking towards your cases, your practice, and your documentation altogether. And yes, a lot of people are using photographs for marketing. I am not a big marketing guy. Although I post my cases every day on social media, but only for to spread the awareness about the cases, to make people learn from my cases, and also I try to learn from the critical comments which I receive on my cases. This is very important. Bad documentation has spoiled many cases. There are thousands of examples on social media. Look at this case. If you see the pre-op and post-op, the result is mind-blowing. But the guy could not document this case properly. I would never ever document my case like this. With fingers, strictly no to retraction. I'm going to talk about retraction and all those points, but good documentation is important. If your work is good, but you are not able to document properly, everything will go for a toss. Look at this case. Patient was a case of gingival fibromatosis, and a nice serial gingivectomy was done. But see the documentation. The procedure is not documented properly. So this is not the way to document surgical cases. I will talk about those points in coming slides. Most important thing, we did this composite and IMAX crown in this case, but look at the post-operative image, especially this crown on maxillary right central incisor. Crown is not up to the mark. Look at the incisal translucency, it looks like a straight line. So I immediately took this photograph, sent this photograph to the lab, and I told him, you have to just copy the adjacent tooth, that's it. And he did some characterization, and believe me, the next image was quite good. So this is how you can improve your work. Please try to document pre and post-op images, and we always send those images to our patients. So what happens, they will circulate their pre and post to everyone, and that is how it will do free publicity. Through social media, they will put their photographs in their groups, family group, friend circle, and that is how you all will get a free publicity. Pre and post operative. Now, if you observe one important thing, in all my images, pre and post are captured in the same angle. I see many times pre-operative is taken from other angle, post-operative is from other angle. Never ever do that. Your pre and post or even intraoperative images should be taken from the same angle. This is very important. You see any of my image, I never miss the plane. I maintain that plane. I always maintain that angle. This is the case. I know the amalgam restoration is looking very bad, but we have done implant placement with 5. Second premolar is implant. Here also. So please remember this important tip. Do not forget to document your pre and post-op case. In this case, patient was not ready for ortho. We tried to convince him like anything. They were adamant, we don't want extraction and 1 year treatment, and they were forcing us. So with their consent, we have done IMAX crown. This is how the case pre and post. But at least this has become ideal case for me to convince now crowded patient having crowded teeth. I explain them this is how I can straighten your teeth and make them good by ortho treatment. Always try to make collage. It is very helpful to convince your patients, and especially collage of the face pre and post op. Okay, look at this patient. We have done FMR. So you can always send this pre and post images to your patient. Let them circulate in their circle. That will be a free advertisement for you all. And even in pre and post image of facial profile, try to click them from the same angle. Denture patient with denture, without denture also makes a huge difference. And that is why I always prefer to capture pre-op and post-op. Never forget to capture pre-op image. Even if you think that you will not able to do good work in this case, still capture pre-op. Because I have observed in many cases in my practice, post-op result was mind-blowing, but at the beginning I thought that I will not able to give good results, and I did not take any pre-op image, intraoral as well as extraoral, and I had to regret in those cases. Now, the next question is why mobile for dental photography? I am not saying that do not use SLR. You can use SLR if you are happy with SLR, no need to move on to mobile. But because of mobile, as it's very handy and portable, I could document thousands of cases. I never feel like jane do yaar kya karna recording, because if you have heavy equipment, sometimes you might feel that. But mobile is so handy, it's a rocket in our pocket. You can document your cases. First advantage, it's readily available, very easy to use and handy. It's lightweight and quick to use. Chairside assistant can use it under your guidance. Now let me tell you one important thing. In all my documentation, in all my thousands of cases, 70 to 80% photographs are taken by my staff, my assistant, chairside assistant, my doctor. I have been training them since many years. In every case, I explain them what I am going to do in this case. They also know the entire procedure like a doctor, because it's very important. They should know what you need to capture. Okay. Does not need knowledge of mobile camera setting. Now, this is very important, friends. For mobile photography, you do not need complete knowledge of camera settings like SLR. So mobile camera is quite easy to use. I will talk about it. Yes, if you are using mobile, you don't need to invest separately in DSLR, flash, and all those heavy equipments, because for a beginner, it could be a big investment of around 1 lakh. Yes, mobile images are very easy to click, store, and reproduce. You can immediately transfer your images. Once your procedure is done, transfer your images in a dedicated folder. I will show you that at the end of session. And yes, anyone can master within a very short span of time. The learning curve in mobile photography is very, very small. Within few weeks, you can master your techniques. What are the requirements for mobile photography? First is you need a good mobile with good megapixel. How much megapixel one needs? 8 megapixel is more than enough. Even you have 5 megapixel camera, it's more than enough. Why and how, I will explain you in coming slides. Retractors. Believe me, I have been visiting almost 70-80 clinics as a consultant since last 17 years. And what I see is people don't even have good retractors at their setup. How much it will cost for a retractor? A pair of retractor will not cost you more than 200 bucks, just 200 rupees. Please buy one good set of retractor. Which retractor? Again, I will explain. Background cloth. Many times we need to take photographs of cast or some crown or some subject. For that, or some object, for that you need some cloths. You can always have good thick cloths of black, green, blue or white color. That will help you get a good background. Oral photography mirrors. I have some wonderful mirrors to capture endo images. For that, I use Relix company, and nowadays zirconia mirrors are really good. Okay, Zirc mirrors. Please buy Zirc mirrors. They are really, really good. The quality of image will be crispy. And I also have some large mirrors. We'll show you. Background paper and acrylic contraster. If you want that black background, you can put contraster in patient's mouth and then capture an image. But in my practice, I never use contrasters. I do that job on editing because I have been editing images since last 10 years. So I'm very much comfortable with editing softwares. I do that background part on editing softwares. You need a well-trained dental and chairside assistant. Believe me, if I have to give half credit to someone, it would be my assistants. They are the pillars of my practice, and I guess it is applicable to everyone. For that, you need to train them, make them part of your team, not as an employee, but as a part of your team, very important part of your team. Educate them, repeatedly hammer them, let them know that these are the guidelines, this is the protocol. They should be well versed with each and every procedure, material, and equipment. Basic idea of photography is important that I will give you today. Okay, now let's move on to the most important question. Which mobile is best for MDP? So, any standard mobile with 8 megapixel camera is more than enough. I will explain you Pixel game in coming slides. But these are the mobiles which I found as very useful and effective in documentation, especially Samsung, Google Pixel, and nowadays iPhone 10, 11, and 13, 12, all those are like really good. iPhone 11, iPhone 12 is now there in the market. They are good for dental documentation, but the initial versions of iPhone were really bad because their flash was very harsh. So harsh flash used to take away all the details. So if you have iPhone 8 and 9, 7 or some other iPhones which don't have good flash, I will tell you how to take care of that issue. Second, Samsung phones are really, really good. Even Google Pixel 2 and 3, they are really good for documentation. There are a lot of other phones in the market. Believe me, they will boast that their pixels are great. They have 20, 30 megapixel. But at one point, even 8 to 10 megapixel are more than enough. You don't need pixels as such for dental documentation. Problem number one is their optics are not good. Optics means when you capture an image, even if it has 20 or 30 megapixel, the image is not good. Image is not focused properly. Many times you see a lot of grains or blue, yellow or red color cast or color in that image. Images look reddish or bluish or yellowish. So the optics are not good. So I have not tested each and every phone in the market, but whenever you want to buy any mobile, I will tell you criteria. Just put retractors in patient's mouth or someone's mouth and capture one image of maxillary and mandibular anterior. In that image, you have to check for 2-3 things. First, color dynamics. Your mobile camera should capture similar or close to what colors you have in patient's mouth. Number one. Second, the details on the tooth surface should be visible. Means your flash should be good. Flash is very, very, very important criteria. Okay, so color dynamics, flash quality. Because of only good flash, you will able to get good details. And third criteria is when you capture maxillary anterior region, that mobile should focus on premolars also. Means it should have good depth of field. If only central incisor are in focus, your camera is of no use. Every time you try to take images, only 2 or 3 teeth will be in focus. So I will talk about that point. We call it depth of field. I will discuss about it. But still, I feel that mobile camera best is yet to come. Although we have a lot of good mobiles in the market, especially this Samsung S20 Ultra, which has a lot of good features. And not only that, we have this Huawei P40 Pro camera. This is amazing camera. They have a lot of features, very costly camera actually, as good as iPhone or Samsung. So if you ask me what is the use of mobile camera, I would say mobiles are effective for portrait photography, landscape photography, food photography, travel photography, architectural photography, night photography, macro photography also, and wide angle. Nowadays, a lot of mobiles have wide angle. Wide angle photography is amazing way of exploring street culture and urban life. So these are different uses of mobile camera, and definitely dental photography is another use where you can effectively use mobile camera. Now let me clear your concept about pixel. Just 2 slides and I will clear your concept. What is pixel? We have been using this term since many years. A pixel means physical point or smallest element in an image. Look at the image of bald eagle and the eye part is cropped. If you crop that eye part and go on expanding that image, when you go on zooming that image, at the end you will see one square. That one square is pixel. So imagine when I say 1 megapixel, what is the meaning of 1 megapixel? 1 mega means 1 million pixels. It means when I say my camera is 8 megapixel, it means the image captured by that camera will have 8 million means 80 lakh pixels. Okay. So many pixels. What is the use of pixel? Pixel is responsible for maintaining details in your image. In that way, you will say then 20 megapixel is anytime better. So totally agree. If you have 40 megapixel, it will have more details. But what is the use for a dentist? When you capture any image from such a closer distance, max to max, we need 8 megapixel. Even if you crop it, your details will be retained as it is. So what our purpose is to show it to our patients, to put it in our mobile, to show it on social media, maybe for publication. Even 5 megapixel is more than image for enough, friends. So don't worry if you have 8 or 10 megapixel, it's more than enough. Okay. So how much megapixel camera I should have? I have explained already. There is no limit to pixel, 12, 30, 40, 50, 60. Even 10 to 12 megapixel is enough. So how to save the pixel? Now look at this image. This will give you a big tip. I call it CCD, capture from correct distance. Whenever you have a patient, how you capture image? You capture image like this. This is the bad way of capturing your images. Do not capture image from such a long distance, because in this image, what is the area of your interest? That red rectangle, right? That's the area of my interest. So now if I capture an image from such a long distance, and if I take that red rectangular area and zoom it, look at the image. Image is appearing blurred because I am losing all my pixels. Suppose my camera is 8 megapixel, all the 80 lakh pixels are scattered on this image. And out of that, I am using only that rectangle, 10% of my original image. So I am losing all my 90% pixels. So the concept is always click your image in dental photography from 8 to 10 centimeters. That's more than enough. Look at this, 8 to 10 centimeter. If you are capturing molar region, then you can go so close to the mouth so that your flash will reach in third molar region. Okay. So look at these images. These are my original images, and this much area I'm going to use means in this case, I will use 50 to 60%, 70% image in this original image. Means imagine how many pixels are there. Even if I zoom it, can see the details. The details won't go away because there are plenty of pixels which are holding details. So very important, maintain a good distance of 8 to 10 centimeter. Check here. In first image, you are using only 10% of actual image because your distance was too away from the patient. And here I am using most of the part of original image. And that is why there is so much difference in the result. Look at the second image. This image has so beautiful details. See, it looks like color dynamics are good. Light is used properly. And I have edited this image and given the background. So all the background clutter is gone. Now, after this introductory part, let's move on to this important section of mobile dental photography. I call it tips, tricks, and techniques. And I will explain you all these tips, tricks, and techniques one by one. The first is light and flash. Second is retraction. Third is framing or composition. Fourth is focusing. Fifth is depth of field. Sixth is sharpness. Seventh is plane of an image. Eighth is mirrors in dental photography. And yes, I will also talk about RAW versus JPEG images. I want you all to understand what is RAW image, what is JPEG image. And yes, the last part is editing. I will maybe take 5-10 minutes to talk about editing so that you will understand the importance of editing. And creativity. Basically, I'm not going to talk about creativity. This is something which I cannot teach anyone. You have to put and pour your own creativity in your cases, and that will develop eventually. You go on editing, you go on documenting your cases. Believe me, your creativity will grow by default. So the first point is light or flash. If anyone asks you what is photography, you should answer photography is all about light. How you capture light, how you live light, how you play with light. So photography is all about game of light. So I will show you some images where light was not used properly. Look at this image. This is not the way to document your case. Look at these images. I will skip little faster. So the first rule, never ever capture images with your chair light on. Chair light, whether it has halogen bulb or LED light, never ever use that light because the light is too harsh. If the light is focused on patient's mouth and you are trying to capture with mobile camera or SLR, that light is too harsh. It will take away all the details. So the first rule is you will always keep your chair light off or move it somewhere else. Turn it somewhere else. Look at this image. Retraction is done properly. Patient has generalized attrition. And what you see is there is very poor light. So due to lack of light, what will happen? You will never get details. For camera to capture details, good light is very important. Although sometimes for artistic purpose, we see that we don't get enough light. But that is different story. In dentistry, in mouth, we compulsorily need light. Light is compulsory in all cases. Remember this. With flash, same image with flash. Look at the image without flash, with flash. Now what you have to check here is your flash should be good enough to give you details. You can see, I can see details on the tooth surface. I can see stains. I can see attenuated teeth. I can see tongue also. It has good depth of field. Depth of field I will explain you later. And see the color dynamics. The original colors are depicted in this image. That is very important. What is the problem of iPhone? This is the problem. Lot of iPhones have this issue. When you try to capture image with flash on, your image appears like this. iPhone, most of the iPhones have very harsh light, so that harsh light will take away all the details. So what is the solution? In European country, many people are using iPhone. That is why they have come out with this solution. But this solution is very costly. I really don't recommend. 40,000 bucks is not worth. Better you buy SLR. Simple. So there is another solution, Cocolux MDP light. This light is amazing. I will tell you what is the advantage. First advantage is it is cheaper. It is marketed by Yogi Enterprises. I will share this detail later on with Dr. Grover or Atmajit Singh, and they can share in your groups. So this is costing 50,000 rupees, and the advantage is the light intensity is 5,500 Kelvin, means daylight intensity. Amazingly useful for shade selection. They also give one filter which you can attach on this light, and it will stop all the reflection. So you can select shade accurately. Third advantage, you can mount any mobile and keep your mobile flash off, and using this good light, diffuse light, you can capture beautiful images. I will show you how it works. So this is Cocolux light. It's a Korean product. It's not Chinese, and it's really useful. Look at the details that you can see. I use it while selecting shade because the intensity is 5,500 Kelvin. And also for documentation, it is good. So if you think that your mobile flash is not good, then only invest. Otherwise, you don't need this equipment. And along with that, I also recommend some light sources to use as an additional light. This is readily available at Amazon. This is called selfie ring light, costing only 600 to 800 rupees. It is rechargeable like mobile camera. You can recharge it and use it. It's really useful. It is available at Amazon. You can buy it of any company. They all are Chinese products. I'm not promoting China, but at one point you can use it. So this is how I try to capture this image by giving backlighting to this leaf, and look at the details. It means if you use light properly, you can capture details very well. And that is what we want in dentistry. We want to capture details inside mouth. So you need good light. Look at this image. This is how I'm capturing, and I got some good details. But I don't recommend this ring light for daily documentation. The light may not be very useful. I use it for documenting some, wow images or some stylish images like this. Then I use it as an additional light source. But for dental documentation, my first choice is my inbuilt flash. Mobile flash should be good. Look at the details. Once you know how to play with light, you can do magic. It's all about light, okay? Not about camera. Camera is secondary according to me. This is how I clicked image. You can get good details if you use light properly, okay? See these images. I don't document every case, but yes, I do document a lot of cases in my practice. Every day, at least, we are documenting one case, either surgical, implant case, or prosthetic case. So all these are good images. You can see the focus on tooth or that prosthesis and the screw. Everything is in focus. Whether you are doing cosmetic work, surgical work, you can always document. See the details. So my message here is, please try to understand light, play with light. Light is very important part in dentistry, dental photography. If you understand how to use light, you are the master. And remember once again, your inbuilt flash has to be good so that you don't need to rely on these additional equipments. Otherwise, you have to buy these additional light sources and go ahead. Second important point is retraction. One of the most important point which I always see missing in Indian documentation. Even good practitioners, they don't use retractors properly. Friends, retraction is like you're opening a door. Without opening door, how will light reach in mouth? It won't reach. You will not able to capture good looking images. The composition will be missing in your images. If you want aesthetically looking good images, you need to put retractors. So I believe retractor is must. What are the important retractors that you can have? I don't recommend metallic retractors. I don't recommend some retractors made up of different wires. Simply go for this retractor. You just see here. I am moving my arrow. Two simple plastic retractors which are separate. They are available in small and large size. Large size for everyone, while small size is for kids as well as few people who are not able to open their mouth. So always go for simple retractor. They are costing maybe 175 to 200 rupees to be very precise. This is bad way of doing retraction. Never ever use these joint retractors for documentation, because what happens, number one, they will never retract your lip properly. Second, they will always lead to lip drop. And third, most of the time they are available with this Govinda color. I call it Govinda color. Jazzy colors, blue, yellow. Never use such retractors. Just use transparent retractors. And I have seen many photographs where people are even using fingers in patient's mouth. Please don't put such photographs on social platform. You are spoiling the reputation of Indian dentistry. Please don't do that. Even if you want to put finger in patient's mouth, wear gloves. It's very important. This is fine, but still retraction is bad. Okay. Look at these images. Two fingers on both sides. So when I am recording a case, I see to it that someone is holding a retractor. See here, there is a shadow. So retraction was good, but angle was not good. Another angle. And now you can see third molar region, post-extraction surgical site. Retraction is important. Look here, I have placed one retractor on the left side, and then I have two Picard's elevator to retract lingual and buccal flap, so that I can capture the surgical area. Also, that lingual Picard's elevator is holding a tongue. Tongue is a big problem in third molar region or mandibular arch. So retract tongue like this. Okay. This is very important. Post editing. Look at the image. This is before editing and after editing. Your images should be clean and crispy. It's very important. So why not these joint retractors? I will explain you. Look at this image. The moment you put this retractor, look at the image. It's very obstructed view, right? And when you edit this, I can see the mustache hair falling in the image. That looks very bad. Especially in Punjab side, you will have this issue very often. So I strongly recommend this kind of retractor. The moment you put retractor, everything is taken care. You can see everything in patient's mouth, especially after editing. Look at the image. So what image you will prefer, upper one or lower one? So definitely you will prefer the image at the base, right? The lower image. That is how I want retraction in my patient's mouth. So separate retractors will help you retract properly. Another important thing, do not pull retractors posteriorly. Pull them outside and outward, labially, means laterally and outward. That's the way. You see any of my case, I pay a lot of attention on retraction. Retraction is very important part. So next time, whenever you try to document a case, please use separate retractor. Achieve your mastery on that and explain your assistants, because half of the time you will be holding retractor, half of the time they will be holding retractor. So retraction is very important part and it's important. Okay. See, after editing, only because of good retraction, I could capture this image. Here also. So first you have to pay attention on retraction. Okay, 2 separate retractors, more than enough. Third point is framing. Framing is also called as composition in the world of photography. Now this is really important. We are slowly moving towards important points. In visual arts, framing is the presentation of visual elements in an image, especially the placement of subject in relation to object. Forget this definition, it is very complicated. I will explain you in simple words. Look at these images at the bottom. All those images are captured by someone, not by me. They are not captured properly. The composition or framing is not good. Suppose I have to capture that first image on the left side, bottom image on the left, I would capture such image like this. This can be my composition. Now you tell me this looks better or this one. So obviously this one. Second, if you want to capture extraoral smile photograph or lip photograph of patient, I would love to capture like this. So composition means how you keep your elements aesthetically in your image. That is very important. Third, whenever I capture any object or specimen, I try to capture this way. It should look properly, or there should be enough visibility. There should be good background. That is very important. And that is why you have to buy some cloths. Maybe yellow, blue. You can buy different color cloths, especially green, blue, white, and black. Look at these images. See the framing or composition, how it is done. If you are taking this kind of images, your work will never appear good. It will always look shabby. Okay. See this image. You can't even make out what person is trying to show. It's very confusing image. Another image. So all these are examples of bad framing or composition. Look at these images. Whenever I capture image, in every image, I pay a lot of attention on framing or composition. I always keep target that my every image should be the best image. So by default, my entire documentation will turn out beautiful. This is very important. So from today onwards, whenever you capture anything, see to it that you have done proper retraction. Whatever you want to show is visible and you are able to capture that properly. This is very important. So if you make every image good, or if you try to capture every image properly, by default, your documentation will turn out beautifully. Next point is focus, which is very important point. I see a lot of images going out of focus. They are blurred. Why images appear blurred? Because you completely rely on your camera or mobile. See, mobile is electronic gadget that doesn't have brain. Mobile will never come to know what you want. So you have to sometimes tell mobile what you want to capture. How? I will show you. Look at this image. Someone wanted to capture those paralleling pins, but that part is out of focus. Because if you just hold camera in front of patient's mouth and go on clicking, you will never get a good image. So first, always remember our mobile has two main things. One is autofocus mechanism. When you hold mobile in front of anything, mobile will by default try to focus on anything that is close to it. But that close thing may not be the thing that you want to capture. So always move your mobile slightly closer away from your mouth so that you will achieve proper focus. That's autofocus mechanism. Second is, when your mobile is not able to focus or it's struggling, you move your mobile little closer away. By default, it will focus. That is called manual overriding on your autofocus mechanism. Or simple way is, you can simply click on the mobile camera or screen, and that's wherever you click, that part will be in focus. Simple way. So all these are example of bad focusing. Okay, everything is out of focus. And remember, blurred images have no value in photography. They are crash, they are trash. Just throw them. Look at these images. Whatever part I wanted to show, it's in focus. So again, I will share tips how to achieve focus. Number one, let the mobile camera focus by its autofocus mechanism, and your hand should be steady. That's very important, because when you try to capture image, when you click or hit that shutter button, mobile takes 2 or 3 seconds to capture image. So if you move your camera, your image will be blurred or it will not come in focus. Second, manual focusing. I told you, you can always adjust the distance of mobile camera. Go little closer or away from the mouth and your camera will focus, and then capture image with steady hands. Third, touch the screen. Means the area that you want to capture. Mobile will focus on that part. Still, if mobile is struggling, it means you need to change the distance. Simple. And sometimes you can try a combination of all these points. This is what we practice in our workshops that maybe we will have in future at Ludhiana. I'm really looking forward. Okay. So look at this image. My assistant was trying to capture this peri-implant tissue topography. Retraction was proper. But see, my camera is focusing at the tooth. Maybe my primary criteria is I want to capture that peri-implant tissue. So I told my assistant, go little away or close. And the moment he moved his camera a little away, he could capture that part beautifully. Now here, some part of tooth is out of focus. Now, had I want to capture that part also, I would have moved my camera little away. So as you go on or move your camera little away from the area, by default, more area will be in focus. This is called depth of field. Means the depth of field will be deeper as you go away. As you come close to the mouth, the depth of field will be shallow. Means very less area will be in the focus. Remember this point. See here, I wanted to focus on that implant, but camera was focusing on the teeth or lips. So I just adjusted distance, and now that implant is clearly visible. I just wanted to show the thread design on implant. See here, everything is out of focus. So move your camera or touch on the screen and everything will be clear. See, your first target is to catch a clear image. Then editing will do another level of magic. Look at this image, everything is out of focus. This must have happened with everyone. So simple thing is, you have to touch on the screen. Still mobile is struggling, just go close or away. It will by default focus on the area and you will be able to capture. Even this image is blurred. If you see closely, let's check the other image that is more visible, right? You can see the occlusal surface is more visible now. See the previous image. So you have to develop a knack. You have to develop that skill in your eyes to check blurring. Okay. Whatever questions you have, please note it down. At the end, we'll discuss. Please note it down. Okay. We'll have separate 10 to 15 minute session. Look at these images. All of them are in focus. So when I document cases, I see to it that retraction is proper, light is proper, which is by default in my mobile, so I don't need to worry. Retraction should be proper, focus properly, okay, and compose and go on clicking. Next important point is depth of field. This is another important point. Look at these two images. Don't look at the girl. Look at the image. Okay. So in first image, you can see there it's written aperture f2. Aperture means opening of camera. Whether it's DSLR or mobile, they both have aperture. Means the part through which light enters inside camera. So when aperture is 2 in mobile world, in photography world, small number means large aperture. F2 means such a big aperture, means lot of light will come inside. So large aperture mobiles or SLRs or lenses are really useful because they give you this dramatic effect, especially for portrait photography or wildlife photography or bird photography or sometimes street photography. You can see the girl is sitting and the part behind her is blurred. It's out of focus. Means when your aperture is wide, you get shallow depth of field, right? And imagine if your mobile camera, most of the mobile cameras have wide aperture, means we are tend to get shallow depth of field. And that is why most of the time, one or two teeth or three teeth are in focus, rest of the part goes out of focus. So how to improve your depth of field? Try to go little away from the mouth. Automatically, your camera will focus on canine and premolars also. But if you have SLR, you can adjust your aperture like f10, 12, 15 and you can take photographs. Wait for another 1 or 2 years. All the mobiles camera will come with aperture setting. Believe me, you will able to set your aperture also. Now also few mobiles have aperture setting. You can increase your aperture from 8 to 10. So right now, if your mobiles are normal routine mobiles, smartphones, where you can't set aperture, you can take care of this issue by moving mobile away from the mouth. So depth of field will increase. Okay. I will skip this part. Distance and aperture, these two things are important. How you will get deeper depth of field? See the distance, 70 mm, 135 mm, 200 mm. Means when you focus from longer distance, when you go on zooming in SLR, you get good depth of field. But anyways, in mobile, we don't have that option. So just by moving distance from the mouth, you can get good depth of field or shallow or deep depth of field. If your aperture is wide, you will get good depth of field. But in dental photography, we want deep depth of field. We never want shallow depth of field. We always want all my teeth to be in focus when I am trying to capture image. So best way is keep your mobile 10 to 15 centimeter away or maybe little away, more away from the mouth. That will solve this purpose or issue. So look at this image. What you see? Central lateral incisors, maxillary and mandibular canine to canine are visible, and see the posterior teeth are going out of focus because I was very close to mouth. So what I did, I just increased the distance from the mouth and my depth of field became deeper. What happened in next image? Look at the image. Now I can see premolars also. This is simple example of how to take care of depth of field issue. Okay, next point is sharpness. This is another important issue. What is the meaning of sharpness basically? So when I say my image is sharp, it means I can distinctly see border of each and everything that I have captured. If your image is blurred, it means sharpness is missing. Or in other way, if you miss sharpness, your image will be blurred. So I was talking about focusing. You remember how to focus, right? Autofocus, manual focus, or you can touch the screen. So if your focusing is good, by default, you will get sharp image. So sharpness means that details have crisp and sharp edges. Look at these two images. Which image is more sharp? So definitely image on the right side is more sharp because retraction is done properly, light is good, and third, focusing is done properly. In first image, focusing was okay, I guess. Problem was, see, the retraction is very bad. Second, light was not there. So because of poor light, you will never get sharp images. So for sharpness, good light is very important criteria. Look at these two images. The image on your right side is more sharp. I can clearly see the lip line. I can see the teeth, their joints, everything. So see these blurred images. The moment image is blurred means it lacks sharpness, as simple as that. But I wanted to explain this point for the sake of your knowledge. So I made it separate. So focusing is good. By default, you will get sharpness. Look at these images. Whatever I want to show is sharp, clear, distinct. You can very well make out what I want to show, right? So what is the first point you have to remember? Camera flash is very important. Good flashlight. If your flashlight is not good, don't worry. Either you change a camera where flash is good, or you can use external light, that Cocolux light or ring light, whatever you are comfortable with. Steady hand is very important, because if your focusing is not good, by default image will be blurred. And yes, nowadays by default mobiles are available with a large or wide aperture, so you get lot of light and good details also. And as I said, simple funda, let camera focus. And if it is struggling, you help that camera to focus by moving it close or away from the mouth. The problem is we keep it at same distance and try to capture and expect that our camera will give us crispy image. That is not going to happen. And that is why the dialogue was there, that man behind the camera is important. Sharpness. Look at these images. You can see every feature. Even you can see parenchyma on the tooth structure. Stippling is visible. Here the impression copings. You can see that. So sharpness is important, but you don't need to worry for sharpness. Just try to focus on focusing. If your focus is good, by default you will get sharpness. These are just few images. Okay. Now, the next part is plane of an image. I don't know how many of you have seen my documentation, but in my documentation, I always maintain a plane. The first image and last image and all images are captured in the same plane, so that there will be a continuity, a flow in my image or my documentation. And anybody who is seeing my image for the first time or cases for the first time, he will understand what I want to say through my work. So your documentation should be like a storytelling. आपकी डॉक्यूमेंटेशन में से एक स्टोरी बाहर आनी चाहिए. इतना डॉक्यूमेंटेशन कंटिन्यूएशन में होना चाहिए कि आपको लिखना भी ना पड़े कि आपने क्या किया है. दैट इज इंपॉर्टेंट. सो प्लेन ऑफ एन इमेज, आई विल एक्सप्लेन यू नाइसली. Suppose I want to capture this maxillary mandibular anterior region. My camera will be parallel to the mouth or teeth. But if you change camera direction, the image will appear different. I'm going to explain you how. Before that, look at this pre-op image and post-op image. Both images are taken in the same plane. So when I show this image to my patient, he should make out immediately, okay, this is how it has changed the patient. After treatment, this is how it's going to make the difference. Look at these images. Everything is same except that tooth, which we have modified. So if I keep my camera at proper angle, my image will appear like this. Now this patient has maybe deep bite issue and some other problems. Consider it as an example. Now if I change my angle like this, and if I capture image, how it will appear, you know? The maxilla will be dominatingly captured. Look at this image. If I change my direction, again, the image will be different. It will focus more on the lower jaw. So what happens? Sometimes you capture images when patient is sitting like this. Sometimes patient is sitting like this, and sometimes patient is sitting like this. So it doesn't matter in what position patient is sitting on the chair. Your camera should be parallel to his mouth. See, wherever patient is going, camera should be parallel. So your images will be similar. Look at this case, pre-op. This was the pre-op image. And if you capture from this angle, maxillary, see, this is how your post-op will look. They look very different, right? If I change my angle, again, how I want my pre and post is like this. They should look similar. So now onwards, whenever you try to capture any case, try to maintain the plane. If mandibular lateral incisor, mandibular premolar region, keep your camera like this. Entire documentation should be from this plane. If you capture one image from this angle, one from this, your entire images, all your documentation will be messy. There won't be any link or continuation. Whenever I capture images, you can open any of my image amongst thousands of cases. I always maintain a plane. Look at this image. I will give you small example. Patient had some issue. There was a Emax crown with central incisor. There was deep pocket. See all my images. They are captured in same plane. Flap was done. Look at this image. All the case was documented in one plane. So it helps my viewer or anybody who is watching my image to see that image or case in a proper way, to understand it easily. How you hold your mobile is important. See this case. Patient is holding a retractor. That's okay sometimes. If you keep your mobile like this, what will happen? You are capturing image from one angle. Always remember that mobile doesn't have camera in the center. It's at one end. Okay. So now in this image, what is the problem? As my mobile camera was at one side, it has captured only one side properly. Other side is hidden. So my camera position should be like this, so that the image will be captured properly and I can see right as well as left side of the image. This is very important thing. There is one option called grid line. Can you see those white lines in this picture? Those are called grid lines. You can go into your setting and set grid lines 3 by 3. It means 2 vertical line, 2 horizontal line. So your screen is divided into 9 rectangles. You have to always focus your mobile in such a way that the area that you want to capture should be in a central rectangle. Okay, this grid line is available in SLR also. Mirrors for dental photography. There are a lot of instances where we need to use mirrors. I use it many times. So there are plenty of mirrors. Now let me tell you difference between two mirrors. One mirror is called front coated and one is back coated. Which mirror is good? So always remember, front coated mirrors are good. Front coated means the reflecting layer is situated on the superficial surface of mirror. Back coated means the reflecting surface is behind, so that light will transfer through the mirror, through the glass. It will hit on the reflecting mirror and come out. So there will be distraction, magnification in the image. Always use front coated mirrors. I regularly prefer front coated mirrors or metallic mirrors. These rhodium coated mirrors are very good. Look at this image. Image is blurred, right? So this is another problem. Whenever we use mirror, the image is blurred because we never pay our attention on focusing. Always remember, focusing is important even when you are using mirror. Look at this image now. I will show you another image. It's taken in the mirror and let's edit that image. Look how clear and crispy this image is. You can see each and every part clearly. So how will you keep your mirrors clean? Number one, never clean your mirror with cloth. Always use paper. Muslin cloth is okay, or tissue paper, soft tissue paper. Second, always wrap your mirror in a paper and then put it in the pouch. Otherwise, there will be dust particle and next time when you try to clean, there will be scratches. Okay. And whenever we put mirror, extra or big mirrors, retraction is compulsory, friends. आप अगर रिट्रैक्ट किए बगैर मिरर अंदर डालोगे तो कुछ भी नहीं दिखेगा. Retraction is compulsory. And then put mirror and always use 3-way syringe of the chair. Let some assistant use it so that there won't be any fog in patient's mouth. Check at this mirror image. And if you know little bit editing, look at this image now, how it looks. You can change your images. See, I captured this maxillary arch and with little bit editing, it looks more better. So editing is an integral part. If you don't want to do editing, I will suggest don't document also. Editing is very important. Mirrors, they are really useful. And as I said, whenever you want to put big mirror, please put retractor. Retraction is compulsory. Okay. Let's talk about endodontic documentation. I am sure there are plenty of viewers today who are good in endodontic work and they might want to do good endo documentation. These are images by Dr. Ganesh Maurya. He is very good with endo. Look at the beautiful documentation of endo work. I am not much into endo, but I can share some tips. You can document your work like this. So this is these are images clicked by my student Dr. Nitin Jain, who had done photography workshop. And after that workshop, look at the way he started documenting his work. The images are crispy, clean. He is using rubber dam regularly. And even when he is clicking images in the mirror he is using is zirconia coated mirror or relax mirror. These two mirrors are really good. This relax mirror is costing only 150 rupees and the quality is good. So another important tip, never ever use your photographic mirrors for daily purpose. I never use this relax mirror or Zerk mirror for daily OPD. Keep it separately, let it be clean and clear. Retraction is compulsory. Hold your mirror in such a way that the tooth will be visible in the mirror, in the center of the mirror. So let patient hold a retractor. With one hand, you can use mirror and with other hand, you can click image. How to hold mobile camera is important. I will show you here. This is my mobile camera. Use these 3 fingers on the back side and let your 2 fingers on the back side and your index finger and little finger will be like this. This is the grip, okay? And you can see it's not falling and your thumb is free to capture image. So with one hand you can practice, okay? This is how you can capture images. Let's edit this image and you get good details. You can use big mirror also and you will get better picture. This is bad way. First, retraction is not done properly. Someone tried to capture image in chair light, which is not good idea, and mirror is in a bad situation, bad shape. Position is also wrong. See the water droplets on mirror. How will you capture reflection? This is not the good way. Look at this image. This is a relaxed mirror or zirconia coated mirror. This is how you have to put your mirror. See the detailing in that image. You will able to capture such images tomorrow onwards. Now the next part is image background. This is also important. If you see any of my implant cases of maxillary anterior region or mandibular anterior region or IMAX cases, crown cases or veneer cases, zirconia cases, all those cases, cosmetic cases, you will always see a black or white or some other background. So there are 2 ways. Either you use contraster in patient's mouth, which is sometimes tedious. I don't recommend that. I prefer to do editing. How to give black background on editing? It's available on a YouTube channel. You can learn it or try to learn it from someone who knows it better. See the image, how it looks pre-op and after editing. It makes a huge difference. See this image? You can remove all the clutter behind mandibular or maxillary anterior teeth. So I will strongly recommend you to learn editing. Okay. With editing, you can take your work at any level. This is the case I was talking about on your right side. Crowding. They were not ready for ortho treatment, which was the ideal choice. But on patient's demand, after taking consent, we have shown this wax up. And this is how we delivered it. Contraster is another way. If you are not comfortable with editing, you can simply put retractors. Retraction is again compulsory. Put a contraster and capture image and edit it. This is how you will get a uniform background. Another image. But I feel personally putting contraster and all is too tedious. Sometimes it can be harassing for your patient. So better you learn editing. That's the best way. Many times we get tilted images. So if your image is tilted like this, don't post it as it is. There are many ways to correct tilt in Adobe Photoshop, in Lightroom, in Microsoft Photo Editor. You can go into rotate image and even you can rotate it arbitrarily by 5 degree, 10 degree, 15 degree, and you can correct that tilt. Even for intraoral as well as extraoral, many times you can correct the tilt. So do not worry if your image is tilted. Important is there has to be good light, good focusing, good composition. That is important. Even this much tilted image can be corrected. Extraoral profile images. Look at these images. Every image has a good background. In my clinic now I have a dedicated white colored wall where I ask patient to sit or stand and then I capture image. You should always try to hide identity of patient. But in my practice, in my consent only, it's written that I am going to document a case and I am going to put your images on social platform or on for advertisement or for training purpose. You should always ask patient before putting their images anywhere, especially facial images. I am not talking about intraoral images. Patient is okay, then fine. See, for lateral profile view, what is important is you should able to see the lateral profile of the image. For ortho documentation, this image is very important. Never keep your patient's head like that. Never take images from other angle. Remember, plane. Plane is very important in such cases. Okay, this is wrong, and that's the image on your left side is the right way. You should able to see profile of the image. Patient. Never ask your patient to stand anywhere in the clinic and capture images. I have seen plenty of practitioners clicking images like this. And never go very close to patient's face. You know what happened? We call it horse face appearance. Whenever you take mobile or DSLR very close to patient's face, the image will be different because patient's nose and malar region will be blown out of proportion. So the tip here is, for extraoral image, always capture your images from 4 or 3 to 4 feet away distance. 3 to 4 feet away. For intraoral, 10 to 15 centimeter away. This is good image. This is proper distance. Patient's face is captured properly. Angle is proper. Now I am going to share something very important, portrait ring light. Now also I have portrait ring light. The light is falling on me. That's why there is a lot of brightness. Okay. And my dark color is little brighter. So I strongly recommend this portrait ring light to each and every practitioner. You know why? Because you can capture beautiful images. Whether your patient is undergoing denture treatment, full mouth rehab, anterior implant, anterior composite, nowadays recording patient's face is very important. And here I am sharing one important tip, friends. Please pay attention. Whenever you have any patient for dental treatment, please capture preoperative extraoral image, because we have to show what impact our treatment, dental treatment has done on patient face. Means you are not showing only impact on preoperative intraoral condition, but I also want to show how my dental treatment has given an impact on his personality, on his face. This is very important. Look at this ring light. This is 18-inch LED light. It's available on Amazon. Order it without fail. And there is a tripod. Don't forget to order tripod and the LED light. That also comes with the mobile stand. And sometimes they also give you mirror, complimentary mirror. So all these images I have captured using that portrait light. Keep it in front of patient and then capture. This is really useful. And I very strongly recommend. Look at the makeover in the patient's face. Look at the makeover in the personality. She was managing director at one company in USA and was here for holiday. She reported my clinic and I told her, madam, you don't only need dental treatment, you need a complete makeover. And I always ask my patient to come with good makeup on their last sitting. We also have a lot of makeup tools in our clinic. This is really important. Look at the makeover in patient's face and in her smile. It's a complete makeover. As I said, never capture images from a closer distance. Capture it from a distance of around 3 to 4 feet. You try this in your clinic. See, I captured image from a very closer distance, how it appears. And look at the image now. Now, what we'll do, we'll use that ring light, bigger ring light wisely and see how this same guy looks. Look at the guy. So you can always capture such images post-operatively. It will add a different charm to your documentation. So now I will talk how to get this effect in portrait photography. I think we are running little late, but I will try to wrap up. I hope you are still stick to my presentation.
We are loving it. We are loving it.
Thank you very much. So now in SLR photography, people use these big lights. They call it soft box to get a good diffuse light on the face. But I don't recommend you because these are very costly. I have come out with a very simple solution. आज सब लोग या कल सब लोग इलेक्ट्रिकल स्टोर में जाओ एंड उनको सिंपल एक एलईडी लाइट मांगो, 12 इंच, 10 इंच का, 15 वैट, 20 वैट, 30 वैट, नो प्रॉब्लम। थोड़ा वैट कम रखो तो ज्यादा हार्श नहीं होगा लाइट। 10 वैट, 12 वैट का लाइट लो, 12 इंच का, जो हम रूफ में लगाते हैं, यू कैन सी दैट। उसको एक लंबा वायर अटैच करके मांगो, 6 मीटर का, 5 मीटर, 6 मीटर का वायर। Look at this wire, so that you can plug it anywhere and use that light as a box, sub box in your clinic. This is simple solution of only 1200 rupees. No need to invest into soft boxes, which might cost you many thousand rupees. And look at the image. Okay, even the external image was beautiful. And look at these different images which I captured using that LED light, 18 inch ka, as well as that external light. So once you have a good light, you can use it the way you want. Look at these images. All these are my participants, my friends. And look at the images. So I want you all to capture portrait images like this. What you have to hold in background is black cloth. So there are black cloths available for photographic purpose that will cost only 1000 rupees. That is called background cloth. You just put it in your clinic, or if you have white background, that will also do. See, in white background also, you will get a good light. All these are my participants from Kolkata, Punjab, and different region. So that was about extraoral photography. Please start documenting extraoral image of your patient so that post-operatively you can show the impact of your dental treatment on your patient's personality. And that is what you have to show. Okay? Object and specimen photography. I never do this kind of photography in my practice. Neither I do like this. Okay? Whenever I want to capture image of any object, I always use some background cloths. These background cloths will not cost you more than 100 rupees each. Please buy some background cloths so that you can capture your images like this. In my all documentation work till now, in last 10 to 12 years, I have never captured a single image of specimen or object or cast or any other work without a good background. Simple background cloth can make your image beautiful. And buy a pant cloth, not shirt cloth. Pant cloth is thick and it is good. It will not reflect light, so you will get a good image. CBCT and X-ray is like ready-made. I take a lot of X-rays with proper precaution in my practice because X-rays can say a lot of story in your documentation. So nowadays we have all digital X-rays. If you don't have digital X-ray and patient is coming to with a X-ray film, please mount it on same LED light that I mentioned earlier, 12-inch light. Mount it on that light, switch on that light, and you will get a beautiful background light so that you can capture everything. But whenever you want to capture any X-ray film, please keep your mobile flash off. It's important. Okay. Look, in all my presentations, all my cases, X-ray plays a vital role, very, very important role. So even in my mind, all the time I'm thinking about X-rays, which X-rays I need to capture. See this case, I observed this case for almost 9 months after grafting. And what important thing you have to notice here is even X-rays are captured in the same plane. That is why you can easily make out the change in the graft or the area around an implant. This is very important. For endo documentation, you can always edit like this. These are the cases done by my wife as well as me. This case is done by me. This is another case done by my wife. So I document even endo cases so that I can sit with my patient and tell them what's the difference between good endo and doing just endo work. Okay. I want to reach till apex. I want to take care of lateral canals. I want to do proper BMP. I want to negotiate each and every canal. So that's the difference when I charge so much. Patient should realize the difference between quality and a cheap work. Now, documentation, planning and storage. We are almost reaching at the last part. Maybe another 20 minutes I need. How to document a case? Number one, type of case. What case you are doing? Surgical, restorative or orthodontic? For orthodontic, documentation is different. Restorative documentation is different. For surgical, you will not able to do documentation because all the time you will be having gloves. So someone else is doing the documentation. That person needs to be well trained. Always plan and visualize the entire case from pre-op to post-op to follow-up. I always visualize how I want to take this case. I never document all cases in the same way. So that is where your creativity plays a major role. And yes, plan all the steps. Initially आप क्या करो? Don't document everything. Decide इस केस में मुझे pre-op, post-op और बीच में 3-4 images लेने हैं. छोटे छोटे डॉक्यूमेंटेशन करो. Make a note. कौन सा स्टेप इंपॉर्टेंट है? Minimum 3 to 4 images of every step. This is very important. कभी भी आप एक इमेज नहीं लोगे. You will always capture 3 to 4 images. थोड़ा close, थोड़ा दूर, थोड़ा पास में, angle change, like that. Because if you capture only one image, that one image may not be good. So always capture 3 to 4 images. Please learn about light. Light is everything in photography. Good retraction is the key to capture good images. Capture what you want to show. I see people just hold camera and capture. Never do that. Your camera doesn't know what you want to capture. So tell your camera, I want to capture this. So that's why capture what you want to show. आपको क्या दिखाना है आपके इमेज में वो कैप्चर करो. बिकॉज माउथ में तो बहुत सारी चीजें रहती है. मेरा फोकस स्पेसिफिक पार्ट पे है तो फोकस ऑन दैट. आइसोलेट रिट्रैक्ट अनवांटेड पार्ट. टंग को रिट्रैक्ट करो, चिक्स को प्रॉपरली रिट्रैक्ट करो. ब्लड है, सलाइवा है, सक्शन करो. गॉस पीस से ब्लड सोक करो, देन कैच द इमेज. आई ऑलवेज डू दैट. And yes, most important, keep your mobile fully charged. Before every documentation, I see to it that I have at least 60 to 70% battery. Now, these are important tips for everyone, friends. Do's and don'ts of mobile photography. Get a good mobile for good documentation. I see a lot of people think that they can take good images with a cheap camera, cheap mobile. It's not going to happen. Without good equipment, you cannot get good result. That's primary criteria. After that comes your skill and all other points. Never use zoom. Mobile को zoom करके images मत लो. That is of no use, at least in today's mobile camera. Never use chair light. We have already discussed that. Flash is compulsory. Please try to buy mobile camera that has good flash. I told you how to buy your camera. When you are going to buy your camera, see to it that you get good details of maxi and mandibular anterior. It means the flash is good. If the flash is taking away all the details, that mobile camera is of no use. Even that can be of Samsung. So even if you are buying a Samsung or iPhone, see to it that your camera gives you good details. Take images from closer distance to save pixel. आप ओरिजिनल इमेज ऐसी कैप्चर करो कि आपको कम से कम क्रॉप करना पड़े. आप अगर इतने दूर से लोगे तो यू विल हैव टू क्रॉप अ लॉट एंड यू विल लूज योर पिक्सल. कीप योर हैंड स्टेडी. दैट्स इंपॉर्टेंट. ऑलवेज कीप योर लेंस क्लीन. ये जो पीछे लेंस होता है इसको हमेशा क्लीन रखो. क्लॉथ से, रुमाल से क्लीन करो, पेपर से क्लीन करो. बिकॉज इफ देयर आर थंब इंप्रेशंस और सम स्टेन्स, योर इमेज विल बी बैड और ब्लर्ड. Set the focus for sharp image. We have discussed this. Remember these 4 important points: retraction, frame or composition, focusing and plane. Angle maintain करो. Spend quality time for editing. मैं जब मेरा केस खत्म होता है मैं बाकी पेशेंट्स करता हूँ. जब भी खाली टाइम है मैं एडिटिंग करता हूँ. Today I posted one case of All-on-4 on Facebook. Please go and see in my personal page. You will see that case. I complete that documentation. I completed that documentation 1 week back, but today I got good time, so I edited that image. So give quality time for editing. Don't edit in hush or rush and post it. Try to understand framing for beautiful capture. Composition is important. Framing is important. And yes, document like telling a story through your image. Store images systematically. Always keep backup. I have a very beautiful way of storing my images. पूरा मेरा एक फोल्डर है डेंटल क्लिनिक. उसके अंदर सब फोल्डर्स है. प्रोस्तो, ऑर्थो, इम्प्लांट. उसके अंदर हर एक पेशेंट का फोल्डर होता है नाम के साथ. मे बी आई विल शो यू दैट सम अदर डे. Understand light. Light is everything in photography, friends. And nothing can beat your creativity, so keep thinking. How and where to store your work? मोबाइल से आप डेस्कटॉप, लैपटॉप में ट्रांसफर करो इमेज. एक मास्टर फोल्डर बनाओ आपके नाम का या क्लिनिक के नाम का, उसके अंदर सब फोल्डर बनाओ डिपार्टमेंट वाइज, और उस फोल्डर में पेशेंट के नाम के साथ ओरिजिनल फोल्डर बनाओ। ऐसे मेरे पास 2000 के ऊपर केसेस है। लास्ट में थोड़े इंपॉर्टेंट पॉइंट्स डिस्कस करते हैं। व्हाट इज रॉ वर्सेस जेपेग? सी, आई विल एक्सप्लेन यू इन सिंपल वे। रॉ इमेज क्या होता है, हाउ इट वर्क्स। जब भी इंफॉर्मेशन और लाइट आपके सेंसर पे गिरता है और आपका मोबाइल कैमरा, दैट येलो कलर्ड लाइन, जैसे के वैसे उसको इमेज में कन्वर्ट करता है, दैट इज रॉ इमेज। बट रॉ इमेज बहुत हेवी होती है। एक प्रोफेशनल लेवल के लिए ठीक है, हम लोगों को कोई जरूरत नहीं रॉ इमेज की। आप सिंपल जेपेग इमेज कैप्चर करो, जो इंफॉर्मेशन सेंसर पे आएगा और हमारा मोबाइल उस इमेज को, उस इंफॉर्मेशन को एक रेडीमेड जेपेग फॉर्मेट में देगा, कॉम्प्रेस फॉर्मेट में देगा, दैट इज कॉल्ड जेपेग इमेज। सो जेपेग इमेज में ही आप कैप्चर करो, नो प्रॉब्लम। रॉ वर्सेस जेपेग अगर देखोगे तो रॉ इमेज इज अनप्रोसेस्ड बाय कैमरा, उसमें सारी डिटेल्स होती है जिसको मैं जैसे चाहे वैसे बाहर ला सकता हूँ बाय डूइंग गुड एडिटिंग। बट जेपेग क्या होता है, इट्स अ प्रोसेस और कॉम्प्रेस इमेज। बट फॉर आवर पर्पस जेपेग विल ऑल्सो डू, डोंट वरी। आप जेपेग में क्लिक कीजिए, नो प्रॉब्लम। रोल ऑफ एडिटिंग, last 10 minutes I will focus on editing. What is importance of editing? Since beginning I have been telling you that editing is second pillar. First pillar is good image, second is good editing of that captured image, third is good work. अच्छा वर्क होगा तो ही सारा डॉक्यूमेंटेशन अच्छा होगा। माय एडिटिंग टूल्स, मैं कई सालों से एडोब फोटोशॉप यूज कर रहा हूँ। पावर पॉइंट एक अच्छा टूल है, बट पावर पॉइंट में करने के बाद भी कई बार मैं इमेजेस को एडोब फोटोशॉप में ले जाता हूँ। सो एडोब फोटोशॉप प्रोफेशनल लेवल का सॉफ्टवेयर है, बट यू कैन ऑल्सो यूज स्नैपसीड। लो देखो बॉटम लेफ्ट में स्नैपसीड ऑप्शन है। स्नैपसीड करके एक मोबाइल ऐप है विच इज रियली गुड फॉर डॉक्यूमेंटेशन और एडिटिंग एक्चुअली। आई बिलीव एडिटिंग इज मेकअप टूल ऑफ एन इमेज। ये इमेज को देखो, एक स्पाइडर का इमेज मैंने कैप्चर किया है। दिस इज विद SLR, but I want to show you the impact of editing. See what happened after editing. See the pre-op image, post-op image. So editing मतलब कोई illegal work नहीं होता है। आप अगर editing से कुछ manipulate कर रहे हो content को, that is illegal, that is not authorized, that is not allowed. बट आप इमेज में से जो डिटेल्स आप बाहर लेके आते हो, इमेज को ब्यूटिफाई करते हो, दैट इज फाइन। ओके, दैट इज नॉट अ प्रॉब्लम। हेलो, या सो लुक एट दिस इमेज। एक फ्रॉक का इमेज है अंडे के अंदर। मैंने इमेज ऐसे कैप्चर किया, एडिटिंग मैंने ऐसे की। दैट्स द इम्पैक्ट ऑफ एडिटिंग। या I will take questions at the end about this JPEG and RAW. Please put your questions at the end. So I want to show you the impact of editing. Look at these images, pre and post. There is a huge difference because of editing. So you all need to learn editing. It's very easy. It's not difficult. In dental also, we edit regularly. You have to edit your images. Editing makes a huge difference. We have seen these photographs already. Okay. Someone is talking. Please, I request, keep your questions for the end. Okay. So editing makes a huge difference. You all need to learn. Editing can create visual magic. See, this is how you will click your image, but this is how you will post your image. So editing doesn't mean some jazzy or complicated work. Cropping of image, brightness, contrast, color management, that can also be called as an editing. I am not talking about these editing disasters. I will skip. So what I feel, makeup can't make everything beautiful. If you think that you know editing well, it means your documentation will turn out beautiful. It's not going to happen. You have to capture your image properly. What are the commonly required editing changes in your documentation? Cropping करो image का, tilt correct करो, size थोड़ा कम कर सकते हैं ताकि ज्यादा heavy collection ना हो, brightness, contrast, color, sharpness भी थोड़ा ऐड कर सकते हैं अगर वो मिसिंग है तो, बट ज्यादा sharpness देने जाओगे तो इमेज ग्रेनी हो जाएगा। Giving black and white background is very important. Removal of unwanted parts. Sometimes मैं मेरे इमेज में से blood stains वगैरह थोड़े क्लीन करता हूँ, that is fine. लेबलिंग ऑफ इमेज मोस्ट इंपॉर्टेंट पार्ट है। मैं हमेशा मेरे डॉक्यूमेंटेशन में इमेजेस को लेबल करता हूँ। enhance or beautify image. Now I will talk about this important thing. There is a software called DTS. ये सॉफ्टवेयर का बहुत बड़ा एडवांटेज है फ्रेंड्स. आप आपके इमेजेस को, पेशेंट जब आता है एफएमआर का और स्माइल डिजाइनिंग का, उसका एक फोटोग्राफ लीजिए, पेशेंट को थोड़ी देर बाहर बिठाइए एंड सॉफ्टवेयर पे मैं दिखा सकता हूँ हाउ पेशेंट इज गोइंग टू लुक. Because of this software, I have converted so many full mouth rehab cases, and we are doing it every day. It's called DTS, Digital Treatment Simulation. It's amazing software. It is by Dr. Neeraj Rohida, orthodontist from Mumbai. I will share details later on. And every day we are using it. It's amazing. One-time fees you have to pay, but I will strongly recommend this. These are collage of different FMR cases. You can always make a collage. Avoid putting surgical images that may scare your patient, but try to put little bit surgical images or no surgical images. I many times prepare collage so that I can explain my patient. At the end, please remember, reading is to the mind what exercise is to the body. I have been traveling all over Asia for lectures. I see our practitioners, especially in India, we don't read a lot. Once you are into practice, we don't touch our book. Today, I can ask question to all of you. When was the last time when you opened book or article and started reading? Reading is very important. Things are changing very fast. It's very competitive, cutthroat practice area nowadays. It's that time, and dentistry is going through a lot of jugglings and all that things. But I believe a well-learned practitioner has no need to worry. He is like all the time safe, and there is always room on top floor. There is always crowd at the bottom. So try to be at the top floor. For that, you need to update your knowledge. And at the end of this session, I would like to put some last wise words from a die-hard traveler, come photographer, come someone who loves life immensely, not from a dentist. Dentistry is not everything in life. It's a part of life. So don't put everything in dentistry. Don't spare so much of time. Try to give some quality time to your friends and family also. Enjoy thrilling and adventurous activities outside clinic. Clinic में तो बहुत सारे adventures होते हैं. I know, you all know. I don't need to tell you. And spend quality time with family, friends, not smartphone. Try to reduce your screen time. We are trying to be more addicted to these social platforms. Use them wisely as per your comfort. Travel like a wild adventure like no one. I am a die-hard fan of traveling. I have been to only 17 countries. 50 is my target. Please start traveling. It will change you as a person. You will come to know what kind of person you are, what is your caliber, what is your existence in this world, only by traveling. Yes, I don't believe in falling in love. Rise in love with someone. Rise. Fall is a negative word. But don't rise again and again. That's important. Okay? And do some crazy things. Be heroic at some moment. आपको लगता है आपका skill enough है. You can attempt complicated cases also. No problem. Worst to worst क्या होगा? टूट जाएगा. Nothing else. Don't worry. Dentistry is a safe profession. So sometimes you can be little heroic. But always take calculated risk. Your health is everything. This is last point where I would like to put or stress, because after our life, most important thing is health. Even before your parents, your kids, your friends, your health is important. If you are not healthy, you cannot take care of them. So try to be healthy. Health is most important thing. In last 21 years, I have never been ill. I have been very healthy since last 21 years. I exercise every day. I'm not a gymmer, but I do push-ups. I do Surya Namaskar every day since 1999, every day. And never give up. Stay positive. Life favors the brave. Don't worry. Things will turn out positive. This COVID era will sooner or later go. Even if it doesn't go, it's not going to kill everyone. Stay positive and keep working with some precautions. Things will be fine sooner or later. And with that note, I finish my session. Thank you very much. I can't hear you, Anil sir.
Sorry, I was on mute. Thank you so much, Akash.
Yeah.
Excellent session.
Thank you, sir.
I think we have to thank IDA Ludhiana branch for taking the initiative to organize this amazing session. And also, of course, Sensodyne for taking up the challenge and getting you on board. Akash, you have practically answered most of the questions that have come in and that we had thought would be there, but still there are few of them. If you can quickly, I know we have
please fire.
2 hours, so we can just make a quick one. Can you let me know what is a raw image and can it be taken with the mobile?
Yeah, as I have discussed, nowadays mobile phones are eligible to capture raw image also. Raw means whatever image, whatever information is falling on the mobile sensor, it will be stored as it is. There won't be any manipulation with that data. But JPEG image means your camera will process it, compress it, and then it will give you a JPEG image. So JPEG image is by default edited image. If you edit that more, you might lose your details. So RAW is preferred in professional level photography for wildlife, model shoot. For dentistry, you don't need actually. With our eyes, you can't make out the difference in RAW and JPEG as such. So for dentistry, you don't need RAW image.
And you mentioned about editing with this during your session. Now, do you think the editing can be done only on mobile, or it's preferred to do it on a desktop or
actually, laptop? I don't recommend mobile for editing images. Editing has to be done on a desktop or laptop compulsorily with Photoshop, PowerPoint, or any other software. But do it on laptop or desktop only if you want to do proper editing.
And how relevant and how accurate is mobile dental photography for shade selection?
Yeah, shade selection is a separate section that I cover in my regular workshops, because this actual session is 4-hour session, which I have compressed in 2 hours. That is also more. Actually, I was planning 1.30. So mobiles can be used effectively for shade selection, but you need to have a filter light or polarized filters, which I mentioned, that Cocolux light that comes with a filter. So using that, and not only for shade selection, for giving information about patients, adjacent teeth or overall his upper and lower arch, you can use mobile camera. They are really effective.
Cool. I know that you already mentioned about the different mobiles which are good for mobile dental photography. But can you give us a list in 1, 2, 3, 4 by the way of, cost and the benefit ratio? I mean, I know that maybe iPhone 11 or 12 is very good, but then it is expensive. So when you calculate, if somebody wants to get into it with a good mobile, how would you categorize them as?
I will tell you, most of the people think that iPhones are great in photography. They are definitely good in photography, but they may not be all the time good for dental photography. Because most of the time I have observed iPhone flash is very harsh. It takes away all the detail. In that matter, Samsung is the best till now. Second, Google Pixel, some OnePlus phones are also good. But again, I will tell you that varies from phone to phone. You have to check personally. And that is what I told you. When you are clicking an image, you should see color tone is depicted properly or not in your image. Whether your mobile flash is good or not. Mobile flash is the primary criteria. Then whether it's iPhone, Samsung or OnePlus or Micromax, Lava, Java, it doesn't matter. Your flash has to be good. Second, depth of field. It should capture all teeth. And sometimes what happens when you are using these third-party mobiles like Lava, Micromax, and there are a lot of Oppo and other mobiles, they will give you yellowish, bluish or reddish cast in your mobile. Pura image आपका reddish दिखता है ऐसे, okay, or yellowish दिखता है. But that is also okay. That I can take care in editing. In editing, that option is there. I can change the color tone and make it normal, exactly similar to patient's color tone. But thing is, they should capture images clearly. That is important.
Thank you so much, Akash. I think that's all from my side.
Yeah.
And once again, thanks to you for this lovely session. Over to you, Dr. Grover, for the vote of thanks.
I think you had some questions, Dr. Grover.
Yeah. I also have some questions. Thanks, first of all, Dr. Akash. It was really an insight, or true insight into the MDP. Now I'll also say MDP, mobile dental photography. It definitely improved my photography for sure. I have a few questions for you. Myself being an implantologist, I'll ask you how to take 3D images. If you are like thinking about 3D images.
3D in the sense, what you mean?
like three-dimensional pictures. Can we take like three-dimensional? Because I was talking to a neurologist and we had a session on neurology, and he was showing us 3D images of brain.
No,
So-
that is through CBCT and all. In CBCT, you can create a 3D videos actually.
What he does, the trick is that he captures it step by step
Yeah.
and from different angles, step by step.
Yeah. And there
So
are some
this is how he does.
there are some softwares that can convert your image into three-dimensional image. But as such, in phone, I doubt there is any phone that can give you three-dimensional image. But you can take images from different angle, buccally, lingually, mesially, distally, and then with the help of software, you can create a
Yeah.
3D image.
That
But I
makes
am
sense.
doubtful about that. That may not be very accurate every time.
Okay. Second question is like when we are clicking the picture, should we wait for the autofocus of the phone, or we should focus by ourselves when we see like the picture is fine?
90% of the time, autofocus gives you by default good focus. Means my mobile will by default focus properly. If it struggles, then just move your mobile here and there or hit on your screen. It will focus. But 90% it works on autofocus, no problem.
And if we have a good flash, like you said, like Samsung phones are the best. So we don't need those extra lights, those rings,
No
or
need.
do we need every time we need those for the portrait pics and all extra pics? Do we need that, or a flash is enough for that?
For portraits also, I used to use mobile flash only. But mobile flash is not enough for a person from 4 feet distance. So I started using that ring light. I will try to show ring light in a part. Can't see right now, sorry. I have done, but you can't see. Okay, so there is a ring light. Please buy that. It's compulsory for everyone.
Do we have any particular dimensions for it?
18-inch. It's available on Amazon. 4,000 rupees is the cost, including that light and stand. 4,000, 5,000 rupees, and it's a good investment for any clinic.
Thank you so much. Thank you so much for your. I have a lot of things to take home. There are a lot of key points like the light. The distance should be 8 to 10 centimeters if we are like taking intraorally, 3 to 4.
Today, I could not show you all the equipments. I could not give you demo. I could not show you all my cases, which would have given like all the points that we have discussed. It could have been a good revision through my cases, but I couldn't show you because of time constraint. Maybe we'll do some actual session. I'm really looking forward.
Yeah, definitely. We'll be looking forward to hosting you in Ludhiana, and we'll be so proud to have Dr. Anil sir also in Ludhiana.
Sure, definitely.
So, sir, thank you so much. You are always supporting. You are like a Kohinoor Hira, I would say.
Yes.
Sir, we always look up to you for these
Thank you.
sessions, and you are doing a marvelous job. Your moderation is too good, sir. And
Thank you for your kind
your
words. Thank you.
unconditional support is hats off to your unconditional support.
Thank you. Thanks.
And I'll also like to thank my secretary, Dr. Atamjit. His son's birthday is today, so he's not available.
Oh,
Yeah, that's okay.
So he's busy there. My treasurer, Dr. Parminder Sidhu, SAR CD convener, Dr. Charan Preet. Our project director for this is Dr. Manish Kataria, Dr. Jaspal, Dr. Man, and Dr. Navdeep. All of our coordinators all made efforts to have maximum participation. Also, I would like to thank our co-host who supported us, like the Sensodyne people, Mr. Devrat Desai, and we have a local guy, Mr. Aman, who supports us unconditionally. Whenever I give him a call, he comes up with these kind of cities. Thank you so much, everyone, and also the participants for your patient hearing. So thank you so much for wonderful evening. Thank you, Dr. Akash. Love to hear you again. Thank you so much.
Do let me know the feedback, doc, afterwards.
Yeah, sure, definitely. I have just put up the questions in my group, which we had made a WhatsApp group, and definitely whenever I get the feedback, I definitely refer it to you.
Yeah.
Thank you so much, sir.
thank you very much. And thanks everybody for joining. 3